Our Bronson Health Chat segment for this week on the topic of skin cancer, how to prevent it, and when you should see a doctor. Dr. Kyle Steeg is a plastic surgeon at Bronson Plastic Surgery Specialist. He has just recently joined the team at Bronson Plastic Surgery, and he and his fellow surgeons provide a broad spectrum of cosmetic, medical, and reconstructive surgery procedures at Bronson. Dr. Steeg's with us on WKZO. Good morning. Welcome to the area. When did you join Bronson?
I started in mid-September. And couldn't be happier. It's a great place to work, and love being back in Michigan. Great people, and best place on earth to live.
Well, good to have you with us this morning here on WKZO on this topic. What types of patients do you see as a plastic surgeon?
Oh, we see just about everybody from people who get injured and end up in the ER or in the hospital for various injuries, all the way to people who are referred to us for elective things like skin cancer and breast reductions, and also people who seek us out for maybe a little boost to their appearance, if that's what they're looking for.
Well, I'm sure many individuals don't realize the scope of a plastic surgeon's work. Doctor, you're here to talk about the topic of skin cancer. Do you see individuals with skin cancer often at your practice, and is that common for a plastic surgeon?
Well, I see skin cancer patients every single day, and I have ever since I started plastic surgery practice about 14 years ago. And they're, like you said, plastic surgery is a really, really broad spectrum specialty, and the stuff that people know about is the stuff that ends up on dramatic TV shows, but we do quite a bit of other stuff to help people out. So, yeah, pretty much every day I'll see at least 2 or 3 people that have skin cancer.
Dr. Kyle Steeg is with us on our Bronson Health Chat segment this morning from Bronson Plastic Surgery Specialists. What types of skin cancer are there? You mentioned there are many different kinds. Are some types worse than others?
Well, one of the worst kinds you can get is a melanoma, and that's a darkly pigmented thing, like a mole that changes, gets bigger, gets darker, gets blotchier. There are 2 other really common kinds that I actually see a lot more commonly. One would be basal cell carcinoma, which looks like a little ulcer on your skin, and another is squamous cell carcinoma. Those 2 look pretty similar, but those are the kind that just get bigger. They don't really have the potential to kill you like melanoma does.
What should individuals look out for? What are the signs that you may need to see someone about possible skin cancer?
Well, so the classic thing is a lesion that's changing, that's the size of a pencil eraser or bigger, things with irregular borders. So instead of being a nice round mole or lesion, it's kind of jagged edged, and certainly any kind of a lesion that bleeds or looks like something that, like a scab that just won't heal over, should probably be checked out.
How can individuals protect themselves from developing skin cancer? And in fact, is there a danger of this year-round?
There sure is. When I think of Michigan, I think of all the outdoor activities we have. So in the summer, you've got golf and boating and all the other sorts of things people enjoy. And in the winter, we like our skiing and snowshoeing and ice skating and whatever you can think of. So being outside in the sun is one of the things that can lead to skin cancer. And the best way to protect yourself is to apply sunscreen and reapply often. Unfortunately, a lot of skin cancer happens many years after things like bad sunburns and things. So you might not be able to go back in time and put on sunscreen, but you can certainly prevent any damage going forward. And you could help your little ones out by, when they go out in the sun, make sure they have sunscreen on and reapply it often.
Doctor, if someone has questions about skin cancer or other plastic surgery procedures, what should they do?
Well, you can start. The easy way is to get in touch with your primary care physician. If that's proving difficult, you can certainly call our office, 269-372-3000. We're Bronson Plastic Surgery Specialists, and I, for one, would be more than happy to see you.
Well, we've been talking with Dr. Kyle Versteeg about skin cancer. Dr. Versteeg is a plastic surgeon at Bronson Plastic Surgery Specialist, with us on this morning's edition of the Bronson Health Chat on WKZO. Doctor, again, welcome to the area, and thanks so much for spending some time with us this morning.
Thanks a ton for having me. Always happy to talk to people and let them know how they can be safer and have a happier skin cancer-free life.
Well, thanks for that. Appreciate your time this morning on Kalamazoo Mornings with Ken Lanphier on 590 and 106.9 FM WKZO.